Ladies and gentlemen,
pacemakers.
all our talk shows are cataloged on YouTube under the blog All India Radio Houston. So please
a lot of work
visit
done for you every week.
YouTube and look for our blog All India Radio Houston. There you can watch the previous interviews and other interesting clips. We have more than 300 videos covering various aspects of Indian experience here in Houston and from around the world. So please visit YouTube and subscribe to All India Radio Houston page so we can keep you updated as to the latest additions to our video blog. Hello, ladies and gentlemen. Welcome to All India Radio Houston. I am Dr. Nik Nikam, and my special guest is Dr. NILESH Mathuria. And we have been talking about atrial fibrillation during the past 15 minutes, and we're going to switch gears and talk about pacemakers. Dr. NILESH Mathuria, first let's give out your contact information, and then we'll proceed with the pacemakers.
Sure. Thank you again, Dr. Nikam. And I am part of the Texas Heart Rhythm Center Electrophysiology Group, and our phone number is 713-541-9955. We have a clinic in the medical center, but also satellite clinics at Memorial Hermann Southwest, Katy area, as well as Clear Lake area.
Dr. NILESH Mathuria is an electrical specialist of the heart. Okay, tell us what is a pacemaker and why people need pacemakers.
Exactly. So a pacemaker is a device
Yeah.
that is it's very similar to almost like a car battery, if you will,
Yeah.
with a wire or a lead that goes in the heart and basically monitors one's heart rhythm. And if the heartbeats get too low,
Yeah.
then the pacemaker will provide an impulse to basically create
Yeah.
a heartbeat, if you will. And so basically, as far as people who need pacemakers, it's very simple. People with symptomatic low heart rates.
Yeah.
So many times there are athletes that have heart rates of 30s and 40s, and they're perfectly fine. But of course, there are majority of us,
Yeah.
we cannot tolerate a heart rate of 30 or so, and if those patients, generally speaking, need pacemakers.
30 plus years ago when I started practice, controlling a slow heart rate was probably one of the major indications for pacemakers, but now you got like so many different indications for pacemakers and different types of pacemakers. So let's talk about all the different types of pacemakers you have and what specific conditions do you use them in.
Definitely. So there's basically,
Yeah.
I'd say, three general types of pacemakers.
Yeah.
One is what you're referring to, Dr. Nikam, traditionally what we called a single lead pacemaker, people
Yeah.
that just had periodic episodes of very slow heart rate. We put one wire in the heart, in the bottom chamber of the heart, and basically anytime the heart rate falls below whatever we set the pacemaker at, it will fire periodically. Other patients may need what we call a dual chamber pacemaker.
Yeah.
Those are pacemakers in both the top chamber, the atrium, or the
Yeah.
bottom chamber, the ventricle. And that has a little bit more complexity with regard to the programming, but essentially it wants to mimic what your natural heart rate or your natural heart rhythm is doing.
Yeah.
If your heart rate periodically gets slow, it will try to mimic by causing the top chamber to beat first, then the bottom chamber
Yeah.
to beat first, or to beat second, I
Yeah.
should say. And then thirdly, there are sort of newer pacemakers called biventricular pacemakers.
Uh-huh.
And those are specifically designed for people with congestive heart failure, with
Yeah.
a weak heart function, and some EKG features showing that the electrical system in the heart is not moving smoothly, if you will. And so in addition to those two wires, a third wire is put in the side back part of the heart, and that allows the heart to beat more in synchronous, if you will.
Yeah.
And that's generally reserved, however, for people with oftentimes congestive heart
So
failure.
in other words, you are trying to mimic the natural pumping function of the heart.
Exactly, that's the
First
whole
the
purpose.
upper chambers contract, then you want both the lower chambers to contract simultaneously
Exactly.
to pump blood in a synchronized manner.
Exactly. As you said already, the heart is the most amazing electrical and
System,
physiologic
yes.
system that at least that
Yeah.
I know of. And naturally, or the way the heart electrical system works, it essentially causes the whole heart to
Yes.
contract within just a few milliseconds altogether.
That's true, yeah.
However, a pacemaker, as fancy as it is, still cannot mimic exactly anywhere
Yeah.
close to what the natural heart rhythm does. So this is where that extra third wire and
Yeah.
select patients can help.
What about, I think your pacemakers are also used for people with irregular ventricular arrhythmias or the fatal ventricular
Exactly, and so
fibrillation,
that's
things
when
like
we
that,
start
huh?
going to talk about something called defibrillators.
Oh, okay, yeah.
And defibrillators have a pacemaker component within them, but their primary objective is to monitor people's heart rhythm for potentially dangerous and fatal, potentially
Yeah.
fatal fast heart rhythms.
Yeah.
In particular, something called ventricular tachycardia or ventricular fibrillation. Generally speaking, most patients that have these already, again, have some component of congestive heart failure or prior heart disease that warranted the defibrillator, but
Yeah.
it has both the pacemaker component and it can monitor you for these bad rhythms. And if, God forbid, one did have a bad rhythm, it
Yeah.
can be life-saving by potentially shocking you out of
Shocking,
this
yeah.
rhythm.
Okay, and ladies and gentlemen, you are listening to All India Radio Houston. We are talking about the electrical system of the heart, atrial fibrillation, and pacemakers. And my special guest is Dr. NILESH Mathuria. If you'd like to join in the conversation, the number to call here is 281-745-4161. We got 10 more minutes left. Okay, let's talk about somebody needs a pacemaker. Walk us through, what are the things that you're going to be doing? Is this an inpatient procedure, outpatient procedure, and all these things?
Sure. So a pacemaker nowadays has become a relatively routine, safe procedure.
Yeah.
More often than not, if done as an outpatient, these are done really as almost like a day procedure where people come to the hospital in the morning, oftentimes stay overnight, go home the next day. In some cases, perhaps even go home the same day. Of course, if people come to the hospital due to this issue, then can be done while somebody's in the hospital. The procedure itself is not an open heart surgery, but we make usually about a 3 to 4 centimeter incision to place the device, and then we have to go in the vein to put the wire. Again, the whole procedure really only takes roughly anywhere from 45 minutes to an hour to do, generally speaking. So most patients tolerate this quite well, and it's really done as like a day procedure.
Is this done under general anesthesia, local?
So this is really done under what we call conscious sedation. So
Yeah.
very similar to if you're getting a colonoscopy or endoscopy. So very temporary sedation lasting minutes and just a lot of local sedation.
Yeah.
And so general anesthesia, generally speaking, is not required. So another reason why most patients tolerate this procedure quite well.
Okay, once you put the pacemaker in and they go home and everything looks fine, how do you monitor if the pacemaker is working all right and is the battery alive? I mean, you buy a car, you don't know if the battery is going to be alive after
Right,
3
exactly.
months.
No, that's a very important question. That's a question that, of course, all patients have.
Yeah.
Because, like you said, it's very much like a car. Except it's on you. And so, what I tell people is, of course, we see patients periodically, but of course, just like getting an EKG, that's just seeing that patient in that moment in time. And so now, just like with everything else becoming wireless in our lives, whether it's phones, whether it's computers, laptops, internet, etc., nowadays even the pacemaker companies and the defibrillator companies offer features of these new devices where we can actually monitor these devices wirelessly while the patient is at home just sleeping. We will actually obtain the device will wirelessly send us the information as far as all the parameters for that device for that patient. It will tell us if all the wires are working well. It will tell us the battery. It will tell us if there's been any arrhythmias that have developed since the last time the device was checked. It will also alert us if there's any changes with any of the settings or if anything has gone out of range. And this is from home where the patient does not have to even come to the clinic. They may not even know that something has changed with their device, but we will know immediately. And then oftentimes what will happen is we can then actually call the patient and say, hey, something does not seem to be right. You may need to come to the clinic, or we may need to adjust some settings or do whatever we need to do, or maybe adjust medications based on what we see. But again, this has really improved quality of life for patients where patients don't have to come to the clinic or don't have to come to the hospital as often.
That's interesting. So if they have an internet connection and a Wi-Fi in the house, maybe they don't need to even put anything close to the heart.
Exactly.
If they have a Bluetooth, then they can be in the bedroom sleeping and they will be continuously monitored.
Exactly, and that's really how these devices have become nowadays, where previously it used to be over a telephone type connection. Now, really, as long as there's a device that is provided with the actual pacemaker, and as long as it's within 10 feet, really, of the device, so usually when people are sleeping, it'll wirelessly download all the information and send us the information immediately. And so really, this is all happening automatically without any buttons having been pressed or anything that needing to be done by the patient.
Ladies and gentlemen, you are listening to All India Radio Houston. I am Dr. Nik Nikam, and my special guest is Dr. NILESH Mathuria. He is an electrical specialist practicing here in Houston and also Sugar Land area. Let's give out your contact information, and then we'll have a few more more patient-related questions.
Definitely. Once again, I'm part of the Texas Heart Rhythm Center Electrophysiology Group, and our phone number is 713-541-9955.
Okay, let's talk about microwaves and radars and airport checks in, outs, and all these things, because there's a lot of problem.
Definitely, and this is probably the most
Yeah.
important question that I hear from patients
Yeah.
before a defibrillator or pacemaker. They're okay with everything, but
Yeah.
they want to make sure their microwave is not affected, or they're not affected because by losing the microwave.
Yeah.
And originally with first generation devices, roughly 20, 25 years
Yeah.
plus ago, there was definitely concern for perhaps some electromagnetic interference with the pacemakers, with other extraneous appliances such as microwaves, etc. But really, in this day and age, all of these concerns are really of no concern. So microwaves are okay. All the day-to-day gadgets, cell phones, etc., are all okay. All the pacemaker companies generally recommend if you hold a cell phone to hold it on the other side, but I have many patients that hold it on the same side and they've done just fine. At airports, you just notify all the security personnel that you have a pacemaker. In fact, you may have noticed if you go to any major airport, there's usually a sign before you cross the check-in area to notify the personnel, and then every airport does it differently based on their scanner, if you need to do a hand check versus go through various security scanner.
So what do people carry in airports to show that they have a pacemaker and not some device that's going to explode?
Right, no, exactly. So when one gets a pacemaker or defibrillator, they really get an ID card that they can place in their pocket,
Is this something
etc.
internationally recognized, like a passport?
Definitely. It has a not only the statement of a pacemaker defibrillator, but it has actually a model, a serial number, a company, a brand, and also the physician and phone number of that physician.
Yeah.
So that way, and really all the vendors and all the companies of the worldwide provide this to all the patients. Number one, not just for airports and other security matters, but just in case if patients wind up if they're traveling out of town and they have some healthcare issue, then another healthcare doctor, etc., no matter where they are in the world, can figure out what the situation is.
Okay, let's give out your contact information, and we got another couple of minutes, and then we'll talk about some more patient-related questions.
Great, definitely. Again, I'm part of the Texas Heart Rhythm Center Electrophysiology Group, and our phone number is 713-541-9955.
Ladies and gentlemen, we are talking about pacemakers, and my special guest is NILESH Mathuria. If you'd like to join in the conversation, the number to call here is 281-745-4161. When I go to buy a car or a battery, I got a 2-year warranty, 3-year warranty, 5-year warranty, like that. Do you give out any kind of warranties in terms of the battery life, and how do you determine the battery life?
That's actually an excellent question. and actually, the short answer is yes. All the pacemaker / defibrillator companies do provide a warranty with regard to the device, very much like a car manufacturers. And in fact, first of all, let's talk about what is the normal longevity of a pacemaker or defibrillator. Pacemakers nowadays have become quite good with regard to their battery longevity. On average, roughly 10 to 12 years battery life with regard to the latest pacemaker models. And just like anything else, it depends on how much your heart is needing the pacemaker. So if your heart only needs the pacemaker once in a while, then the battery may last much longer. Defibrillators, given the more intricate processing involved, etc., their battery life is still not as high as the pacemaker, but somewhere in the order of 5 to 7 years. All the device companies provide various warranties with regard to this, and so occasionally if the battery does deplete prematurely, etc., which can happen to, let's say, car batteries, the various manufacturers will actually provide coverage and will provide, cover your costs, etc., for changing out the battery.
Okay, with that, Dr. Mathuria, it's been a pleasure talking to you.
Thank you very much, Dr. Nikam. I really appreciate the opportunity.
Get you back on. It's very fascinating. We'll get you back on and talk about other irregular heart rhythms.
Look forward to it.
Ladies and gentlemen, you have been listening to All India Radio Houston, and we'll be back next Saturday at 10 a.m. I'm Dr. Nik Nikam, and this is 1050 KCH
Ladies and gentlemen,
Texas.
You are listening to All India Radio Houston on 1090 AM. This is a talk show where we focus on one or two topics in depth on a variety of subjects. If you would like to hear on a particular topic, call us or send us an email, and we will try to get experts to share their views and opinions. If you would like to be a guest on this program and share your